Dear students, welcome back. In the previous session, we have discussed about the main arteries which supply the entire lower limb. Now, in this session, we are going to discuss about the branches which are arising from the main arteries and their supply. Okay. Now, first we will see the femoral artery. The femoral artery is the continuation of the external iliac artery, and at the mid-inguinal point the femoral artery will start. The femoral artery here, it gives two kinds of branches. One is the superficial branches and the deep branches. The superficial branches are the superficial epigastric artery and superficial circumflex iliac artery and superficial external pudendal arteries. So these are the superficial arteries. And coming to the deep artery of the thigh, that is called as profunda femoris artery. This profunda femoris artery will give again different branches. One is this is the profunda femoris artery, and it is also give another deep branch called as deep external pudendal artery. All these superficial arteries, the name itself indicates the area where it is going to supply. For example, this superficial epigastric artery ascends across this ligament and run upwards and medially towards the umbilicus. So it is called as epigastric artery. Normally the circumflex artery supplies the skin and superficial fascia of the anterior superior iliac spine area, and whereas the external pudendal artery which supplies skin over the external genitalia and over the lower part of the abdomen. Okay, so the deep external pudendal artery runs medially deep to the fascia lata. It becomes superficial after crossing the adductor longus, okay, and supplies the external genitalia. Actually here we can have a deep pudendal branch. Okay, now we will see the profunda femoris artery. This is the largest branch of the femoral artery and is the main artery of the supply for the muscles of the thigh. Okay, and it gives medial circumflex artery and lateral circumflex artery, and then the perforating arteries, Okay, this medial and lateral circumflex arteries will supply will give some branches to the hip joint also. Okay, and this lateral circumflex artery will have a descending branch of lateral circumflex artery, which will take part in the anastomosis around the knee joint. Okay, and these perforating branches will supply the muscles of the medial aspect of the thigh and posterior muscles, as well as the finally these perforating branches end up by supplying the muscles and finally end into the vastus lateralis muscle. So this is these are all about the blood supply of the femoral artery. And we will move on to the next one, is the popliteal artery. Yes, here you can see the popliteal artery, which is coming back of the thigh through the adductor magnus, and it runs posteriorly on the posterior aspect of the knee joint, so it is called as popliteal artery. And at the lower end of the popliteus muscle, lower border of the popliteus muscle, it terminates into anterior and posterior tibial arteries. So meanwhile, in this course, this popliteal artery is giving many branches. It is giving some muscular branches, superior muscular branches, and also it is giving some genicular branches. So that means these supply to the knee joint. One is the middle and lateral superior genicular arteries, and lateral and medial inferior genicular arteries, and middle genicular arteries. So 5 branches are arising from the popliteal artery. Okay, so these are the branches of this popliteal artery. Now we will move on to the anterior tibial artery. Here comes the anterior tibial artery. This anterior tibial artery, so once it enter into the anterior compartment of the leg, so it gives a recurrent artery called as anterior tibial recurrent artery, which helps in the formation of the anastomosis around the knee joint. And this anterior tibial artery is giving many muscular branches to the muscles of the anterior compartment of the leg. It supplies anterior compartment of the leg muscles, and then after at the level of ankle joint, it gives anterior medial malleolar artery and lateral malleolar artery. In the middle, this anterior tibial artery continues as dorsalis pedis artery on the dorsum of the foot. Okay, so after it forms the dorsalis pedis artery, it gives lateral tarsal artery and medial tarsal artery, and this one continues as the dorsal metatarsal artery finally. Before continuing as dorsal metatarsal artery, it gives an arcuate artery, where it gives digital arteries for second, third and fourth interdigital spaces, and these arteries finally gives a pair of small digital arteries which supplies the toes. So by this way, this anterior tibial artery will terminate. Okay, so next we will move on to the posterior tibial artery. Here in this, the posterior tibial artery is giving a large branch called as peroneal artery, which gives muscular branches. The branches of peroneal artery are muscular branches to the peroneal muscle, and a nutrient artery to the fibular bone. Okay, and some of the communicating branches and the perforating branches we can see here from the peroneal artery. And this is the one of the longest artery which is present on the posterior part of the leg, that is posterior tibial artery, which gives some of the muscular branches for the posterior aspect muscles, and at the level of the ankle joint it gives some malleolar branch, and it also gives some calcaneal branches, and finally it ends as plantar artery. This plantar artery, once it enter into the sole of the foot, it divides into medial and lateral plantar arteries. Okay. the medial plantar artery gives muscular branches which are located on the medial side of the sole, and it finally terminates as the metatarsal arteries, and this will join with that of the dorsal metatarsal arteries by the perforating arteries, and this metatarsal arteries finally ends into the digital branch of the great toe on the medial side. And this lateral plantar artery, it runs medially, it runs laterally and downwards, and it forms an arch like arch called as plantar arch over the basis of the metatarsals, and from there it gives some plantar metatarsal arteries. Okay, and this plantar arch end up by joining with the what you call as arcuate artery of the, which is present on the dorsum of the foot, like this. It will join here. So the plantar arch joins with that of the arcuate artery by the proximal perforating artery. So, and these plantar metatarsal arteries, so how many? 4 metatarsal arteries arising from the plantar arch, and this will end up into a pair of digital arteries, and the metatarsal arteries are going to perforate with the dorsal metatarsal arteries by the distal perforating arteries. Okay, so and also the plantar digital arteries and dorsal digital arteries are also joined with each other by the distal perforating arteries. So these are all the branches which are arising from the main branches. Thank you.